Angina. On your handout, you will see that it says, how does angina feel? And on this front page, there is a little guy all marked up in several spots. And I will talk about each of those, about what has been said by heart patients of how you all describe your discomfort you have. Now, angina is a fancy word for chest pain. I have learned over my nursing years that heart patients do not consider what they feel as a pain. So I use the word discomfort. So to give you an example, when you all come to the emergency room or the doctor's office and the doctor or the nurse says, I want you to rate your chest pain, you all say, I don't have any, or 0. We write that in the chart, and in reality, you are feeling something. So that's why I've learned to change my wording to the word of discomfort, because as you guys describe what you feel, you do not relate it to the word pain. And so unfortunately, we write no chest pain when in reality, you may be having a discomfort. So on the front of your page, your little guy is marked up in all kinds of different places. And on the back side of that front page at the bottom, it says symptoms of angina. And those symptoms of angina is what heart patients have actually used to describe what you are feeling. Well, on this front page, the little guy is marked up just in the center of his chest. It does not have to be in the center of your chest. It can be on the right side. It can be on the left side. It can be going all the way across your chest. And the most common words used for that is heavy, tight, squeezing pressure, an elephant sitting on my chest, sharp pain, dull ache, stabbing pain, indigestion like burning sensation. Everyone feels it different. And I will distinguish between male and females because through American Heart Association's research, that's how they found out women were having heart problems. We women always kind of got kicked off to the side and everyone thought we never had heart disease. And now it's a fact that heart disease is the #1 killer for women. We still are lagging behind the men, but we are very rapidly catching up as they continue the research. So the most common for a female is the burning or indigestion, but I do see a lot of men have that. So just so you know, both sexes can have the same symptoms, but I just will distinguish what's more common in a female than in a male. And I do have the females have the heavy, tight, squeezing pressure. The other one is in the middle of the shoulder blade or in the shoulder blades or in the middle of the back. A lot of times that is described as the stabbing from front to back or back to front, or I will hear a lot of patients say you ache, or sometimes if you've been doing yard work or lifting something heavy, you relate that to a muscle ache. The difference on angina and a muscle ache is when it is a muscle ache, if you move around and if it's in the back or in the shoulder, if you move your arm around, you will make that discomfort or pain happen. Or if you told me during your exercise that you were having some type of discomfort, wherever you're hurting at, one of the first things I will do is come up and I will push on you, if it be in the chest, in the back, on your arm. And when you push hard on someone, if it's a muscle, we can reproduce that pain and make that pain or discomfort happen worse. Well, if it's angina or a heart symptom, I can't make that pain or discomfort feel worse. It will feel the same no matter if I push or don't push. So that's one way to distinguish if it's muscular or not. As you see, this little guy is marked down both arms and it goes down an entire arm. A lot of people that know someone that's been diagnosed with heart disease think it only is the left arm, and it is not always the left arm. It can be the left arm or the right arm, or it can be both arms. It does not have to go down an entire arm. Some people say it does. But the most common areas when it does affect an arm that people complain about is in your wrist area, your elbow, the upper part of your arm on the outside, or the upper part of your arm on the inside that goes into your armpit. And it goes into your fingers and hands. The most common word when it hits your arms It is the one time that I have heard patients use the word pain, but the most common word used when it hits the arms or the hands is numbness and tingling, and people describe it close to like when you lay on your arm wrong and your arm or leg falls asleep. You feel that tingling sensation, and that's what it's usually like when it's the arms. You will also see on the top of your handout, the third guy over from the left side of your handout, it's the top of the belly. And a lot of people think the top of the belly, there's no way this can be the heart. This is very common in a female also, but males do have it. But when we see it in the top of the stomach, patients describe this as a fullness feeling. If I could just burp, I sure would feel better. And so a lot of patients will go take Tums, they will take seltzer water, they will get a Sprite and do anything they can to burp. Well, one way to know if it's like a reflux or a GERD or just gas on your stomach from a burp is you may burp and the discomfort you're feeling gets relieved, or it might get better, but then it very quickly comes back. Well, indigestion or gas bubbles don't keep coming back. So when it keeps coming back, a red flag should go up in your mind, this might be something else. The other one that you will see is at the bottom on the far right side of your handout is not only in the middle of the chest, but it's like a band wrapping around the bottom part of their chest or the top of their waistline. And that's when people are saying that their air feels like it's cut off. So that's a very common feeling people feel. Also, people describe it into their neck and into their jaw. And in the neck, it can be the front part or the back part. But when it's the front part of your neck, people will feel like your throat's shutting off. And some people say it's like a reflux coming up. And on the jaw, it can be your right side, your left side, or both sides. And most people describe that as a clamping down, a clenching down, or man, I got a bad toothache. And it can even go into the earlobes. Now, before I move forward, one thing I must stress, and I may say more than once on this, is when we ask you to describe or give us a level of your pain or discomfort of 0 to 10, just know that 10 or 8 does not mean you're having a heart attack, and a 1 or 2 does not mean you're having a heart attack. Everyone feels pain and discomfort differently, so you could feel it as an 8 and not be having a heart attack, and you could feel it as a 1 or 2 and be having a heart attack. Also, because diabetics are known to develop neuropathy, which means they lose nerve ending feeling, they may not have any of these symptoms at all and never have any discomfort anywhere in these areas because they're not able to feel discomfort because they have neuropathy within their chest. The other thing for people to know is on these symptoms on this front page, 25% of our population does not have what's on this front page, which is the most common symptoms. And the reason that is 25% of our population, some of them may be diabetic, so a big part of our diabetics fall into that, but people that aren't diabetics also can fall into that. So never, 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 and I can't stress that, go on the intensity of your pain or discomfort of deciding, do I use my nitroglycerin or do I need to call my doctor or the emergency room? I'm going to give you guidelines as we go through, and that's how you determine what do you do, when do you go to the emergency room, when do you use nitro. It's not about the intensity. And the next thing I want to say, and I'll probably say more than once, is angina symptoms and heart attack symptoms are the exact same symptoms. If you were a private friend of mine and you called me on a weekend and you list all these symptoms and you say, Marcia, am I having a heart attack? I cannot tell you that over the phone. I'm going to ask, did you do A, B, C, and D? And if you did all of that and you still have discomfort, I'm going to tell you to go to the emergency room because you cannot distinguish a heart attack on intensity of pain or just because of your symptoms, since they do say the same thing. Now on your next page, your second page, in the middle, it talks about associated symptoms. These symptoms either are the only symptom you have, if you're in that 25% that doesn't have that front page, or you may have 1 or 2 of these symptoms also with what's on page 1. Just remember, you only need one symptom. Sometimes the advertisements on TV or if you're on the internet, they make you believe you have to have more than one symptom. You only need one symptom to immediately say, this might be my heart. And the one thing I want to say is when we know patients have heart disease, you've had a stent or you've had bypass, when these symptoms show up that we're talking about in this handout, we always want you to assume it's your heart. We don't want you to assume it's indigestion or something else. And it's not to scare you, it's because heart is the most critical and that the ultimate thing that can cause death. So we're trying to prevent heart attack or lessen heart attack and definitely prevent death. And so we want to assume that it's the heart and teach you these steps to take. And hopefully at the end, we're able to tell you it is something else. But if it is the heart, we're catching it early enough. And before I move forward about these associated symptoms, on that front page, there's some things that very much can mimic these symptoms but not be your heart. If you are someone still with the gallbladder, when it decides to act up, your gallbladder sits on the right upper side of your stomach, and when it acts up, it can go to having pain or discomfort in the center of your chest, top of the belly, go into your right shoulder blade, cause nausea, vomiting, and sweating. That is everything that's in this handout, but it can be a gallbladder. But we don't want you to assume that until we know that it's not your heart. In the handout, we talked about indigestion and burning sensation can be a symptom. And yes, it could be GERD or reflux, but we don't want you to assume that. We want you to assume it's the heart. We're going to take the steps and let's see what happens after the steps, and hopefully at the end find out it is a bad indigestion or reflux. But when I get into talking about the nitro, that will make more sense. On the associated symptoms that are described in your handout, shortness of breath. Shortness of breath can be very vague, and especially if you are a lung patient with asthma, COPD, emphysema. When we talk about shortness of breath, you notice there's a change in shortness of breath. All of us know how short of breath we are when we walk across a parking lot to our car, or how short of breath we are when we go up a flight of stairs. If we have to stop halfway up. When there is a change in what's normal for you, and you normally don't have to stop going up the stairs, and now all of a sudden you stop, that needs to be a red flag. That can be an angina symptom, and that's something to be alerted about. Sweating. Sweating and dizziness I'm going to talk about together because diabetics, that can be a very early sign of your sugar getting too low. So I always ask a diabetic when you're breaking out in a sweat or dizzy, please take a finger stick, see what your blood sugar is. If it's within normal limits, then we're going to go back and assume it's the heart. If you have a low sugar, then obviously we want you to treat your blood sugar. But on the sweating, when you break out in a sweat, heart patients say they definitely know a difference. So when it's 90 degrees outside and you guys have been doing something outside that's making you sweat, it's a different sweat. People describe this sweat as a very cold sweat, and usually you are soaking wet immediately. It's not a just slowly come on sweat. You can even be inside the air conditioning, sitting there watching TV, doing nothing, and you all of a sudden will break out in a cold sweat, or it is described as women's hot flashes. Nausea and vomiting is very vague, and that symptom typically usually goes along with another symptom because nausea and vomiting can be just a GI upset or some type of flu symptom. One symptom that a lot of patients have in the very beginning, but you don't realize you're having it until you're down the road, is weakness and fatigue, or you lose energy. We all, as you're in cardiac rehab, some of you as you begin have a low energy level, but as you continue on, we get that energy level back through proper increase of exercise and strengthening that heart muscle up. When we get your energy level back, and you ever see that your energy level starts to go down, when you're doing things around your house, you have to stop in the middle of doing your things around the house, or your normal activity during the day, you're taking a lot of rest breaks. Those are things we need to know, because a lot of times fatigue is an early sign, we just don't realize it, because angina means lack of oxygen going somewhere to the heart. And when you're not getting proper blood flow to the heart, then it's not going out to the other circulatory system properly, or the organs, and it makes us very fatigued. So that is a red flag that something might be going on. So that's an early symptom. Now, as you flip your page in your handout, you're going to come to a handout that angina is in the center of your page, and on one side it says angina, and the other side says angina with heart attack. And this is when we distinguish the difference between the two. Angina, you still have an artery open, but you don't have proper blood flow. You may have a 90% blood flow or 80%, but we know you have decreased blood flow, which means you're not getting the same amount of oxygen. On the other side, a heart attack means you have an artery totally shut down, either by a blood clot shut it down or some plaque broke off downhill. The duration of angina typically only lasts 5 to 10 minutes, either with rest or nitro use, and we'll talk about the proper use on that here in a minute. But know that angina typically goes away within 5 or 10 minutes. We get very concerned you're having a heart attack when you hit a 20-minute plus time limit of having one of the symptoms. Now, just because you're having a symptom for at least 20 minutes or longer does not mean 100% you're having a heart attack, but we are very suspicious of that. And so that's when we start talking about calling 911 and getting to the emergency room. And that'll make more sense when I talk about the nitro. But just to move in on that 20 minutes, in the cardiology field for very many years, we've had a saying of time is tissue or time is muscle, which means by the time we realize we're having these symptoms, up to 20 minutes, 20 minutes is the end of your time block, and at 20 minutes we say call 911 and go to the emergency room. So if it's a heart attack, we decrease damage to that heart, and we're saving heart muscle. And that's the most important thing about a heart attack, is decreasing damage. On angina on the handout, there are factors that can make angina happen. I wish I could tell every patient that had a stent they will never, never, never have problems again. But unfortunately, there are things that make angina happen. And sometimes those vessels are just making a spasm, like a muscle has a muscle spasm. So if you overexert yourself, and that could be truly you're overexerting by doing a lot of hard labor work, or sometimes people that are out mowing their grass and they're even using a self-propelled lawnmower, which is just a casual walk behind that lawnmower, that could be too much exertion for that day. Why? No one has a reason. Your heart is just irritable at that moment. When we get upset emotionally or we're stressed out, we can cause ourselves to have these angina signs and symptoms. So that can bring it on. A heavy meal. I always use this, especially as we get closer to the holidays. When it's holidays or family gatherings, when it's birthday or any kind of special occasion that we get together and celebrate, we Americans tend to overeat, unfortunately. And I talk about Thanksgiving on this one because a lot of people have heard that turkey has tryptophan in it. Tryptophan is a chemical that makes you tired. Well, at Thanksgiving, we seem to all pig out on all this food because we always think there's not going to be enough food for all of us to eat. So we just pig out, and then we lay down, and because the tryptophan kicks in, we fall asleep watching the football games. Well, what happens is all that blood supply starts going to the stomach to start the digestion process, and then our emergency rooms get flooded with people with chest pain because they overate. So I always teach people, don't deprive yourself when you're at a special occasion, if it be holidays or birthdays or any barbecue or anything's going on, but do smaller amounts and just eat more frequently so you don't have that immediate blood flow just going straight digesting and not going anywhere else, and then you end up in the emergency room with chest pain. The other factor that affects is our weather. Too hot or too cold of weather. And while you're here in cardiac rehab, you will hear from Amanda or Dennis about doing your exercise outside in too hot or too cold of weather conditions. Now, we don't say you have to stop your life. and especially we live in the Midwest, so we know what the weather and the humidity is. There's guidelines of that you do not do your exercise or any activity when the heat index or temperature is above 85 degrees. Well, we know in July and August we hit 90s, and it doesn't mean you can't exercise or go out and do things. But what it does mean that you wait, even though it's still 90 degrees, till the sun goes down, your humidity's down, and do things either early or late, but you don't mow your grass or do exercise at 2 or 3 o'clock in the afternoon when it's hot. The other important factor is drinking water and staying hydrated out there so your body doesn't get too stressed and you get dehydrated. Too cold, as we're going into the fall and winter months now, is anything below 40 degrees, wind chill or temperature. You do not exercise or do things outside. And one thing you're going to learn is no more shoveling the snow. Now, a lot of people get upset about that because they have no one to help them, but other people think that's the best thing about being a heart patient. When you are outside, yes, you can brush off snow if it's a light snow, but picking the heavy snow up and actually shoveling it and throwing it over your shoulder, you no longer can do. But when the temperatures are 40 degrees and below, your mouth and nose always need to be covered when you're outside, walking across a parking lot or exercising, because when you take a direct hit of that cold air, your heart pumps harder, it's asking for more oxygen, and then you end up with chest discomfort. So you must protect your mouth and nose during these fall and winter months so you don't bring on the symptoms. A heart attack. You usually have no prior events that are happening. You weren't upset about anything. And actually the statistics are on heart attacks that between the hours of 2 o'clock in the morning and 6 o'clock in the morning is when most people are having a heart attack, which is usually when you are sleeping or just waking up to get ready for work. So if you are ever awakened with chest discomfort, shortness of breath, that's not normal. Why is those statistics out there? We don't know, but that is the statistics of the biggest number of heart attacks happening. It's not the biggest number happening all the time when people are shoveling or mowing the grass. What relieves your discomfort? On angina, again, rest or nitroglycerin, which I'll talk about in just a minute. On a heart attack, nothing relieves your discomfort. We might get you a little bit relief with morphine by the ambulance or in the emergency room, but usually we don't get that discomfort gone until we get you to the cath lab and open that artery up. So there is a difference, and again, you're at the 20-minute mark. The biggest difference between angina and heart attack is angina, you have no heart damage, and that's what we're going for. You don't want heart damage. On a heart attack, a portion of your heart muscle has been damaged, and it doesn't matter if it's a small heart attack or a big heart attack. When you have a heart attack, that part of your heart where that vessel is feeding your heart, that part is now damaged, and you don't want to do that. But if you're going to have a heart attack, that's where that 20 minutes comes in, and the quicker you get to the ER, the less damage happens to the heart, and that is the most important part if you're having a heart attack. Now we're going to talk about nitroglycerin, and this is when I learned which patients have nitroglycerin and which ones don't. If you are an open heart patient, we don't prescribe that after open heart surgery just because open heart's done differently than it was done in the 80s, but if you have it, it's fine to use, but we will have different guidelines as I go through this. Anyone that's had a stent or heart attack that does not have a prescription for nitroglycerin, please let myself or one of the other nurses know so we can get you a prescription of that. Some rules I'm going to teach you about nitroglycerin first, nitroglycerin is your best friend, and it needs to be with you 24 hours a day. If you have symptoms, it does you no good if your nitroglycerin is at home and you're at the grocery store having some chest discomfort. So again, it must be with you all the time. Another rule is, please put the date on the bottle when you start carrying this bottle, because every 6 months, no matter if the bottle's been used or not, it needs to go in the trash. Nitroglycerin is very light sensitive and temperature sensitive and can lose the effect. So every 6 months, it needs to go in the trash. How you know a few different ways if your bottle's bad before that 6 months is when you use it, you stick it under your tongue. You do not chew or swallow your nitroglycerin. You just let it dissolve. You should always feel a sting, a tingle, a burn. If you don't feel a sting, tingle, or burn, the bottle's bad. You need to throw it away and start carrying another bottle. The other way is knowing is when you open your bottles, if you start seeing the little tablets, because they're very tiny, crumbling up and disintegrating a little bit, and you're getting a lot of powder, that has already lost its effect. So go ahead and throw that bottle away and start carrying a new bottle. Nitro's been around for many, many years and is a very cheap medication. We encourage you all now, since it's available, they have little containers that's a little bigger than your nitroglycerin that you can buy at the counter at any pharmacy. Heart patients tell me they're anywhere from $3 to $5, and some of the dollar stores are even carrying them for $1. That way it gets extra protection from the temperatures outside, or for someone that carries it in their pants pockets where it's picking up on your body temperature. Now, how the proper way to use nitroglycerin is when you realize you're having one of these symptoms that's mentioned here in the handout, and typically angina does come back the same way you had it the first time, but it doesn't have to, so that's why we want you to know all the different ways. But as soon as you notice it, no matter what the intensity, remember, intensity is not the important thing, does not mean if you need to take nitro or if you're having a heart attack. The first thing you do is sit down and rest for 5 minutes. And please watch your watch or a clock, because now we're starting that 20-minute time clock that we just talked about. Rest for 5 minutes. If your discomfort is a total 0, you feel absolutely nothing after 5 minutes, you don't need to do anything. You just need to sit there for minimally 15 more minutes and rest. If you have longer, go ahead and rest longer. But if you got right back up after that 5 minutes and start doing whatever you were doing, your discomfort will come back because your heart's irritable and it just needs to calm down for a little bit. If it did not totally go away, it might have gotten better, but you're still feeling something, after that 5 minutes, it's time to use your first nitro. Put your first nitro under your tongue, don't chew or swallow it, let it dissolve, and let it sit there for 5 minutes. The biggest problem that I find with heart patients is they space their nitroglycerin out by 15 minutes, 30 minutes, or an hour. It is a very quick drug that's in and out of your system in 5 minutes. So you must stack this if you need to do it. So put one under your tongue. After 5 minutes, evaluate. What do you feel? Now you're at the 10-minute mark. If it goes away, you don't have to do anything. Just sit there and rest for at least 15 minutes. If you have longer, go ahead and rest longer. If it doesn't go away after that first nitro and waiting 5 minutes, now you use your second nitro. And now we're going into the 15-minute mark. Wait 5 minutes. After 5 minutes, reevaluate what you're feeling. If it's totally gone, what you were feeling, a big fat 0, not a 1 or 2, but a 0, just continue to rest. Don't get up. Rest for minimally 15 minutes. If you have more time, then that's fine. Sit there longer. If it does not go away after that second nitro in 15 minutes, now you're using your third nitro and you're going into the 20-minute mark. Put the third nitro under your tongue, and now you're at the 20-minute mark. There's 2 times we ask you to call 911. On your third nitroglycerin, or if chest discomfort, shortness of breath, or any of these symptoms wake you up in the middle of the night. Chest discomfort and shortness of breath, or any of these symptoms pulling you out of sleep in the middle of the night, is not normal. It's an automatic call to 911. Now, I have heard every excuse why you can't call 911. The biggest reason is lack of health insurance, and it's going to cost too much, and I understand that financial stressor, but we will worry about that once you get here. Because the reason we ask you to call 911 is because when you're having a heart attack or possible angina, your heart can do what's called funny little beats. These funny little beats can be life-threatening. They are the beats that can make you go unconscious, and we have to use the paddles. So you don't want to take that risk. If you were driving yourself, you'll go unconscious. Your chance of survival is minimal. If someone else is driving you, unless they're at the emergency room, chance of survival is minimal too. So those are the only 2 times to call 911. When do you call your doctor? If you're using nitro more than 3 to 4 times a month while you're in cardiac rehab, we need to know. We need to know every time you come if you're having it. But if you're using it more than 3 to 4 times a month, cardiology needs to know. They will reevaluate if you need a heart cath, a stress test, change some medicines, but it's important for us to know so we know what's going on, because prevention of a heart attack and catching it sooner is the most important.